what the medical field is not going to tell you. With my own lived experience through deep tissue, anytime I would get clients that had scoliosis, completely different ball game than someone who had a regular spine, like a spine like that is the normal way of what a spine is supposed to be. I could help people feel better, but for some people, it just wasn't, I wasn't able to, it's something that they were going to have to always just like maintain. And yeah, like I had people come in a lot of times and I would help them and like their pain would go away. But like for some people, what I'm saying is some people it didn't. And if you had scoliosis or something, it wasn't going to. Now, how is this related to the medical field? Well, because it's the same. When you have a disease, when you are outnumbered, when you have something that is irregular, when you have something that is abnormal compared to the average human body, they're not going to be able to help you. They're not going to know what to do with you. And to be honest, they're not going to know what to say. Because they're not going to know what to say because they don't know how to help you and they don't know what to do. And there are no answers. Reality check, boom, sorry, but there are no answers. And so if you're someone who's been to the doctor and you're so confused because nobody says anything to you, or they don't have good bedside manner, or they don't really know how to respond, for one, remember, they're human just like you and I, and they're part of society just like you and I. But two, they're based off of proof. They don't know what to say. There's nothing for them that prepared them for this moment, probably, for them to say to you. And yeah, you may be going to an eye doctor, but these eye doctors, they're treating people with like average problems. They're not treating like 25-year-olds, 30-year-olds who have glaucoma or have cataracts at that age or started macular degeneration. Because what's the average is like starting macular degeneration when you're like 70 years old. Sorry. So what I'm trying to tell you is to not expect answers from people when what you're dealing with is not the average common person problem. They're not going to know. But what I'm trying to say is that sometimes what you have to do is alternative medicine, nervous system regulation. Because when the medical field can't help you anymore, that's traumatizing. So what are you going to do with it? Well, you got to get your nervous system in check, because if you don't, it's just going to take over your body and it's going to make you more sick and you're going to have more symptoms and illnesses as this pent up shit collects in your body and gets worse. That's all. It's a tough ride for people who have issues that are not, it's a tough ride. It is. And I'm validating your experience, but I'm also trying to help you realize and say too that I hear you, that the doctors aren't even there for you. I get it. They're not for me either. But that's okay.